How's it going, my friends? Sorry I've been very busy this week and therefore I haven't been very active on my channel, but what I wanted to talk about today is hair loss as it relates to women and whether or not some of the more conventionally available treatments for men like finasteride can also be used by women. So we know that when it comes to discussing androgenic alopecia, the focus is usually on men, and that's for good reason. It's because androgens cause hair loss in individuals whose hair follicles have a genetic sensitivity to male hormones, namely dihydrotestosterone, DHT. And since men produce a lot more androgens than women, we see a lot more men go bald than women. But nevertheless, women can lose hair, and androgenic alopecia is still the most common cause of hair loss in women. Now, there are other things that can cause hair loss in women, such as thyroid issues, eating disorders like anorexia or bulimia, as well as traction alopecia, which is from overly tight braiding, and even from telogen effluvium, which is hair loss caused from physically or mentally traumatic experiences. But nevertheless, the underlying cause for most women losing hair is still female pattern baldness. Now, with a few exceptions, the mechanism behind female pattern hair loss is the same as it is with male pattern baldness, as the problem is still a genetic sensitivity to androgens. What's much more common with female pattern hair loss, though, is the scale of progression. Now, with males, we use the Norwood scale, which is where hair loss starts at the temples and vertex, and it recedes until the temple hair loss and vertex hair loss meet, eventually leading to a Norwood 7, which is when all the hair on the scalp is lost, except for the sides and back, which is known as the Hippocratic wreath. Men don't lose hair in that region because they are more resistant to DHT, and thus they're often like where hairs are harvested for hair transplants. Now, with women, what dermatologists will typically use what is known as the Ludwig scale for progression, which is defined as a more diffuse pattern of baldness where the hair loss begins in the middle of the scalp and then teeters off to the side, leaving a trace amount of hair all over the scalp, but seldom complete baldness everywhere. Now, this next point is a little bit off topic, but I should point out that because there will usually be at least some hair there, women in diffuse thinners typically respond very well to hair fibers and other concealer products because the fibers will attach to what little hair is there and make them look much fuller. This is, of course, just a cosmetic and not an actual treatment for female pattern baldness, but I think it was important to point out. And another thing important to point out is that men can also experience diffuse thinning, and women can also lose hair in a more male pattern baldness style. And, you know, why one pattern affects the other gender more isn't known, but we know that androgens play a role in both male and female pattern baldness. But since men produce more androgens, we see a lot more bald men than women, as I already pointed out. So, even though women are less likely to be hit by the bald curse than men, they also don't have nearly as many approved treatments at their disposal. I mean, if you are a woman and you go to the doctor's office and say you are losing the hair, they may just tell you to take Minoxidil and send you on your way, or they may refer you to clinics that perform unproven theoretic treatments like platelet-rich plasma therapy, or at worst, they may recommend something that is complete garbage, like a laser helmet, or they may just say something like, "Just shave it, babe!" But doctors won't be able to recommend much usually, because unfortunately Minoxidil is the only FDA-approved treatment for hair loss in women. It used to be only that 2% was approved, but recently 5% Minoxidil was also approved for women, which is an improvement. Now, some women do respond very well to Minoxidil. I mean, I have often mentioned that Minoxidil is not a good standalone treatment for men because we still have the underlying issue of dihydrotestosterone destroying our hair follicles, and even though this can also be a problem for women, women don't have nearly as many androgens destroying the scalp hair, so oftentimes Minoxidil can be a good standalone treatment for women, and there are many women out there who have used Minoxidil long-term and have never had to add anything else, so it could be Minoxidil is a good enough treatment for you. But the problem, however, for some women is that a lot of them just will not respond to Minoxidil treatment very well or at all. And you see, the reason why this is because in order for a topical Minoxidil product to work, it has to be able to convert into its active form, minoxidil sulfate, which is contingent on the presence of sulfotransferase on the scalp. Some people produce too little of this enzyme for Minoxidil to be effective, so for them, putting Minoxidil on their scalp would be similar to just putting water on the scalp. It would not be any better than just a placebo. So, what can women do if Minoxidil doesn't work or doesn't actually work satisfactorily for them? Well, we know for men, the first line of defense against hair loss is finasteride, but this treatment is only FDA approved for men. Its use in women is controversial due to the risk of birth defects, but nevertheless, many women have looked into off-label use for this drug to see if it has any benefits similar for women as it does for men fighting hair loss. Fortunately, even though it isn't FDA approved for women, there is still a plethora of research on finasteride's use in women for fighting female pattern baldness, and that is what I wanted to go over mostly today. So, even though finasteride has been proven very effective at suppressing DHT levels on the scalp, the biggest and most obvious potential issue with finasteride is that it's classified as a pregnancy category X drug, which means its use is contraindicated in women who are or may become pregnant. Now, the 5A reductase enzyme plays a crucial role during the development of male fetuses, including the development of the male genitalia. Now, the gender of a fetus isn't known until 18 to 22 weeks of gestation, though, so this isn't something that can be determined early on enough for finasteride to be safely used during early pregnancy. Now, finasteride is also contraindicated in women who are breastfeeding because of its potential effects on male infants. I mean, I guess it gets passed down in breast milk, I don't know, but it's probably best to trust the experts on this one. But given the serious risk of birth defects, I have to say oral finasteride can only be considered for use in women who are postmenopausal or have had a hysterectomy or cannot bear children for any other reason. I mean, maybe they were born without a uterus. I mean, it's known to happen. But because of this danger, it is absolutely mandatory that a woman considering this treatment see a doctor first. Absolutely do not self-medicate. If you self-medicate, you're stupid. Now, besides the risk of birth defects, another risk worth pointing out is that finasteride can have an effect on testosterone and estrogen levels, potentially raising both. So estrogen, we all know, is the main female hormone, but in women who have had a family history of breast cancer, the presence of estrogen can worsen or potentially initiate breast cancer. So if you fall under this category, or if you otherwise are at high risk for breast cancer, like for example, if you have a strong family history of breast cancer, then finasteride should not be considered without careful consultation with your physician. And even if you don't, you should still talk to your physician anyways. Now, I also want to point out that even though Minoxidil is the only FDA-approved treatment for female pattern baldness, there are also other pharmaceutical options that are backed by clinical research. So topically, there is alpha-tretdiol, which is a 5A reductase inhibitor that works locally, and it has been shown to slow hair loss at a rate that is below but still comparable to 2% Minoxidil. And for men, alpha-tretdiol is usually better as an adjunct treatment since it isn't particularly powerful. But for women who don't have as many androgens on the scalp, it stands to reason this might be a more effective treatment for them. In addition to that, there's also Fluridil, sold under the brand name Eucapil, which is related to the drug Flutamide, which is a very powerful anti-androgen, and in studies it has been shown to accelerate the androgen growth phase of the hair follicles by upwards of 80%. The drug doesn't absorb systemically, hence it is safe for women. It's also safe for men as well. And another sometimes off-label prescribed treatment for women who are suffering from female pattern baldness is oral spironolactone. Now, topical spironolactone has also been tested for hair loss, but it's been pretty much proven to be bunk. I mean, there have been studies even where the subjects would cover half their bodies in topical spironolactone, and it barely had any effect on serum androgen levels. So topically, spironolactone is pretty much worthless, or at least very close to worthless. Orally, though, spironolactone, it's a diuretic, but when taken at high enough doses, like 100 milligrams or more daily, it has a strong anti-androgenic effect. And because of this, it's sometimes prescribed to male to female trans women to block testosterone, and thus it isn't a viable option for men who don't want to transition. But for women, the drug has been used successfully to treat female pattern baldness. One potential issue, though, for some women is that since it is a diuretic, some women can suffer from dehydration and also get high blood potassium from it, which could be very, very serious in some circumstances. Also, if women have any history of kidney disease, they shouldn't use it. So what about finasteride? Can this also be used by some women to fight hair loss? Well, like I said, there have been several studies looking at finasteride in women, and I will highlight the most important ones, and I will link a review article that has all the studies that I will mention below, so you can review it yourself as well. Now, the first study is a double-blind randomized control trial involving 137 post-menopausal women. The patients were randomized into two groups to receive either a 1 milligram tablet of finasteride daily or a placebo, and both groups were monitored for a period of 1 year. The results were assessed using photographs in addition to patient and researcher assessments of hair growth, as well as scalp biopsies under a microscope. So pretty good methodology. Unfortunately for Team Finasteride, though, this first study didn't show any effect of low-dose finasteride versus placebo. So at low doses, at least according to this study, it seems like finasteride is pretty useless. But what about at higher doses in the usual 1 milligram daily dose that is prescribed for men? Well, this is an interesting question because doses greater than 1 milligram in men have not been shown to suppress more scalp DHT, just more serum DHT, which is why 5 milligrams of finasteride is usually the prescribed dose for enlarged prostate compared to 1 milligram for hair loss. Now, I've stated before, finasteride is not a very dose-dependent drug, at least not for men, which is why many men use it successfully at doses below the standard dosage. Sometimes doses even as low as just 0.2 milligrams every other day have been proven to be effective. However, we cannot jump to conclusions that the dose response of finasteride is the same in men and women. After all, women have a different chemistry than men. So studies have been done on higher dose finasteride in women, and they've shown some pretty interesting results. A study of medium-dose finasteride, 2.5 milligrams daily, which is basically just half a Proscar tablet, was performed by my bro Ludwig, and he's the same guy who rightfully pointed out that finasteride side effects are usually just psychosomatic. And the study was small and involved just 5 women with female pattern baldness. 4 of the women were given 2.5 milligrams of finasteride daily, and 1 received 5 milligrams daily for 6 months. And all 5 of the female patients showed stabilization of hair loss, and 4 out of the 5 showed hair growth after 6 months. And now I don't want to dwell on the study too much because it is a very small study, but I did want to give a shout out to Ludwig because I love how he triggers all the anti-finasteride trolls, and his research regarding the psychological aspect and the nocebo effect regarding finasteride side effects are very interesting. I've talked about them before on my channel, and if you haven't read them, I'd highly recommend doing so. But anyways, getting back on subject, a larger study was looking at 2.5 milligrams of finasteride daily in 37 women with female pattern hair loss over 12 months. And it showed enhanced hair density in 62% of patients, which is corroborating the theory that larger doses of finasteride are more beneficial in women than in men. However, this study was done on premenopausal women who were on birth control, and the investigators concluded that the results could possibly have been due to the anti-androgenic effects of the birth control pills, because birth control pills are usually derived from estrogens, and all estrogens have at least some anti-androgenic properties, so it's difficult to confirm the veracity of the study, but it's possible at the very least that finasteride helped them. So let's get serious here for a moment and move on to the full 5 milligram dose of finasteride we'd find in a Proscar tablet. So in an interesting randomized control study of 48 hyperandrogenic premenopausal women with female pattern baldness, 4 different therapies were tested. Now, one group got finasteride at 5 milligrams daily. Another group got Spironolactone, which is a very strong anti-androgen, which is usually used to chemically castrate sex offenders, and it can also theoretically be used by male to female trans women, although it is apparently very hepatotoxic, so I question whether it's viable for long-term use under any medical circumstances. And that group of women also got estradiol, so they basically had their entire endocrine system overhauled just for this study. Now, the third group got Flutamide at 250 milligrams daily, and Flutamide, it's similar to Spironolactone in the sense that, again, it's a very strong anti-androgen and is chemically similar to Fluridol, but unlike Fluridol, Flutamide does absorb systemically and thus is not a viable treatment for men, and likely it's not very viable for women either because, like Spironolactone, it's also known to be very liver toxic. Finally, the fourth group got no treatment, and it was an open-label study, so it wasn't blinded. The people in this group knew they weren't getting anything, so no placebo this time. So at the end of the one-year study, all patients, including the control group, showed decreases in the Ludwig scale, which again is the scale used to measure the progression of female pattern hair loss, so surprisingly, everyone had improvement. This really demonstrates why it's so important to have a control group. You know, scalp hair on people, whether they have the baldness gene or not, goes through both growth and resting cycles. So for example, if that control group had received some sort of bogus therapy like a laser helmet, you might assume that laser therapy worked just because there was an improvement, but without a control group, we cannot know if these changes weren't just due to a spontaneous improvement not related to the treatment. So that's an important lesson you should consider when examining any scientific study. So getting back to the results of this trial, the best therapy did appear to be Flutamide, which gave a statistically significant reduction in the Ludwig score. However, 2 patients had abnormal liver tests develop on flutamide, which further demonstrates why flutamide is probably not a safe long-term treatment, just because it's so hepatic toxic. Now, there were no side effects in the finasteride group, but the authors concluded nevertheless that finasteride was ineffective in this case. However, remember, this is a very specialized group we're talking about here. Most women who are losing their hair do not have hyperandrogenicity. It's fully possible to have normal hormone levels as a woman and still have female pattern baldness, which is why I'd like to delve into this next study. Now, the next study looked at 87 pre- and postmenopausal women with female pattern hair loss who had normal hormone levels. 86 out of the 87 patients tolerated 5 milligrams of finasteride for a year, while only 1 patient had to drop out due to headaches. This study used a phototrichogram, and this is a tool which is probably the best way to measure hair growth, since you can zoom in on the scalp and record how many hairs are located per square centimeter, and that's much better than just doing like a photo assessment, which can be influenced by things like, lighting, or even like bias from the researcher or the subject. And that's why I think it's good that they had a phototrichogram, even though they also did use photos, but a phototrichogram can make sure you have an exact count and how much hair growth you have. But anyways, the phototrichogram showed an increase in hair density of 18.9% and hair diameter by 9.4% with finasteride compared to baseline. So the photographic evidence showed clinical improvement in 81% of patients. All of this looks pretty good, though having just talked about the importance of a control group, I think it's worth mentioning this study in fact did not have a control group. However, I think with phototrichogram derived evidence, this study at least had stronger endpoints than the previous study. Now, another uncontrolled study looked at 5 milligrams of finasteride daily in 40 postmenopausal women who have female pattern baldness. And again, they all have normal hormone levels, but 55% of the patients reported major improvement, while 30% reported moderate improvement, and 15% reported no change over 6 to 18 months of treatment. And it seems that patients over the age of 70 have a poor response compared to the younger patients. But the big issue with this study is that it seems to be that the endpoint was pretty subjective, and again, there was no control group. Nevertheless, looking at all the data so far on oral finasteride, it does appear that higher dose oral finasteride has benefits for women who have female pattern baldness, even though we could probably stand to have a few higher quality studies, like, maybe a double-blind randomized control trial. But what about topical finasteride? Well, if you remember my video comparing topical finasteride to oral finasteride, the results were similar in terms of both the suppression of scalp DHT and serum DHT, and the studies included subjects who are both male and female. So let's quickly review a couple studies on topical finasteride that I've talked about. So in the first study, a placebo-controlled study of 0.005% topical finasteride solution was given twice daily for 16 months in 52 patients, including 28 men and 24 premenopausal women. Now, the men and women in the finasteride treatment group showed a greater reduction in hair shedding than in the control group. Now, this is a very small dosage, keep in mind, yet it still worked, which is interesting since with the oral finasteride studies, it seems women needed to take large doses, at least 2.5 milligrams daily, for it to be effective. I mean, remember, the 1 milligram didn't do anything for them at all. Now, another study on topical finasteride looked at women exclusively. This was a double-blind randomized control trial comparing 3% minoxidil alone versus 3% minoxidil plus 0.25% topical finasteride. This study was performed in 30 postmenopausal women. The group treated with minoxidil plus finasteride showed increased hair diameter after 24 weeks of therapy, and increased hair density was observed in both groups. Using photographs at 24 weeks, 93% of patients in the combined treatment group showed improvement in hair growth, but this was not significantly different from the minoxidil group. So a lot of this improvement was probably just due to the minoxidil, which wasn't given in the previous study, but judging from the study, it does seem adding finasteride helped, as the group getting minoxidil and finasteride got better results, at least in regard to hair diameter compared to the group just using minoxidil. Now, in looking at all these studies, it's interesting to look at the incidence of side effects of finasteride in women. We know that even though it's very rare, finasteride can sometimes cause sexual side effects in men. So looking at one study of 87 women, headache, irregular menstruation, dizziness, and increased body hair growth were reported in 4 patients, but the side effects were minimal and transient, which means they went away on their own, much like they do with men who continue to use finasteride. Now, in some studies, reduced libido has been reported, but again, this is a rare side effect which often goes away with continued use. So For dutasteride, which I wanted to go over briefly, for those who don't know, dutasteride, it's another 5A reductase inhibitor like finasteride. There is unfortunately very little data on its use in women, but there is a case study of a 46-year-old woman who didn't respond to finasteride or minoxidil, but then ended up getting results from dutasteride at 0.5 milligrams daily, which is the standard dose. And in another database study that looked at a random sample of 30 women treated with finasteride 1.25 milligrams daily or dutasteride at 0.15 milligrams daily, there were similar effects between finasteride and dutasteride judged by photographs, though it appeared that dutasteride may have been superior in women aged under 50 years old. So overall, there is limited data with dutasteride, and even though dutasteride's mechanism of action is similar to finasteride, clearly more data is needed, especially since finasteride seems to work differently with women compared to men, so we shouldn't make assumptions about the outcomes of dutasteride in women. So getting back to finasteride, overall, even though more research is needed, it does seem that finasteride may be a viable option for women, whether it be administered topically or orally. Although, of course, in the case of oral finasteride, it does seem, according to research, that more than the standard 1 milligram dose is needed. The big caveat, of course, as I've already stated, is that in most cases, it shouldn't be used by women of childbearing age. Now, there are exceptions, of course, such as women who cannot bear children for whatever reason. Maybe they've had a hysterectomy, or maybe they're on a very strict birth control regimen, but it's still important to keep in mind this risk. Also bear in mind that this usage is strictly off-label. It's not FDA approved, so it may be difficult to find a doctor willing to prescribe. So if any ladies are insistent on trying to get a prescription, what I do is try to get my prescription from a hair transplant surgeon, as in my experience, they tend to be the most liberal when it comes to writing prescriptions. But to summarize, what I've said, finasteride does work in women, even though they may need larger doses, and it also appears to be pretty well tolerated. I mean, possibly even better tolerated than in men. And so it is an option for treatment of female pattern hair loss, but women just need to be extra careful not to get pregnant if they're going to use it. And, you know, fortunately, we're living in the 21st century, so there are plenty of ways for women to do that even while remaining sexually active. So, you know I don't have too many female viewers, but nevertheless, I do get asked about this sometimes, and I thought it would be an interesting subject to tackle since there isn't much discussion on the subject. So even if it doesn't apply to you, I still hope you found the video interesting and educational. Maybe you can, like, a woman who's suffering from hair loss, and you can refer this video to them. But in any case, I'll see you guys next time. Hope you have a good day. Take care.